Hi, this is Dr. Kenzie from Mahoney Chiropractic Group. And if you've been dealing with lower back pain, sciatica, or a disc injury, and nothing seems to be working, here's likely what's going on inside your spine, and more importantly, what actually helps. So stick with us for just 5 minutes, and this could change how you think about recovery. Spinal decompression therapy is a non-surgical treatment that gently stretches the spine using a motorized table. And the goal is to take pressure off the compressed discs and irritated nerves so your body can actually heal. Here's a myth we hear constantly in the office. My doctor told me I needed surgery. And absolutely, sometimes surgery is the right call. But a significant number of disc herniations and bulges and sciatica cases resolve with conservative care, including spinal decompression therapy. So no incision, no recovery room, and no downtime. And that's exactly what we do here. So why does the pain stick around for so long? Here's the short version. Your discs do not have their own blood supply, so they rely on movement to pull in the oxygen and nutrients they need to heal. And when you're in pain, you move less. When you move less, the disc gets even less of what it needs to heal. So it becomes more dehydrated, more compressed, and more irritated. And the cycle just keeps going. So add in long hours at the desk, a physically demanding job, poor sleep, or years of cumulative stress in the spine, and you can see why this does not fix itself on its own. So when you come in for your first visit, we're not just gonna put you on the machine and hope for the best. That is not how we work. We start with a real conversation about your symptoms, what makes them better or worse, and what have you already tried, and what your actual goals really are. Then we do a thorough physical and neurological exam, checking your range of motion, strength, and nerve function to figure out exactly which levels of your spine are involved. And if you have imaging, we review it. If not, we tell you whether or not we think you need it before we start care. And before any of that, we screen for red flags. So sudden loss of bladder or bowel control, rapidly progressing leg weakness, or severe pain after a trauma, these all need to be ruled out before treatment begins. So your safety is always the first conversation we have. So once we know what we're working with, your care follows a clear 4-phase plan. So phase 1 is about calming things down. So there are decompression sessions several times a week, combined with chiropractic adjustments to restore nervous system function and joint mobility. And the goal is getting you out of acute pain so movement becomes possible again. Phase 2 is about restoring motion. So as things settle, we reduce decompression frequency and start introducing gentle mobility work. So your spine needs to start moving well before we can ask more of it. So phase 3 is where you become the active part of the plan. Involves targeted spinal rehabilitation, retraining your neuromuscular system to protect the disc, stabilize the spine, and help you be able to confidently return to the activities that you love. And phase 4 is maintenance. So we set you up with a home plan, ergonomic guidance, and a continued check-in schedule so your results actually last. And we're not interested in keeping you in the office at 3 times a week forever. We want you to get back to your life. So depending on your case, we may bring in a few other tools along the way. So class 4 laser therapy is something we use in the earlier phases for some patients. It works at the cellular level to support tissue healing and reduce inflammation. And it's not a standalone treatment, but as part of a broader plan, it can meaningfully support the healing process. So shockwave therapy may be a fit for you if there's significant soft tissue involvement alongside the disc condition. And here's what we want you to hear clearly. We do not recommend a technology just because we have it. Every tool we use is chosen based on what your exam findings actually call for. If it's not indicated in your case, we don't suggest it. Simple as that. Let me give you a real example of what this looks like. So we worked with a patient in his late 40s, an office worker, 7 months of right-sided sciatica, so pain down the leg, barely sleeping, couldn't walk for more than a few minutes without severe pain. MRI confirmed a disc herniation at L4, L5 in his spine. So we built him a 12-week plan combining decompression, chiropractic care, class 4 laser therapy, and spinal rehabilitation. By week 3, his leg pain was down 40% and he was sleeping through the night. So by week 5, he was walking again comfortably, and by week 10, full return to activity. And his disability score dropped from the severe range all the way down to minimal. And this is not a miracle. This is what a structured, individualized care plan can do for the right patient. If this sounds familiar, the next step is really simple. So book a consultation with us here at Mahoney Chiropractic Group in Colchester. So we'll assess your case, walk you through your options, and give you a really clear picture of what your care would look like before you commit to anything. And you can also download our free spinal decompression guide at the link below. So it's everything you need to know before your first visit, all in one place. So we are here when you are ready, and we can get you back to your life.